Welcome to the Parkland Report. My name is Seamus Riley. Joining me on this edition, Peg Boyce, Program Director for Dental Hygiene. Welcome to the Parkland Report.
Thank you.
Dental Hygiene.
Happy to be here.
Great to have you. Dental Hygiene has a long and storied history here at Parkland College. Exactly how many years has it been around? You know?
Oh, I think we had our 40th year anniversary a few years ago.
Well, since the college is only 50 years old, that means that Dental Hygiene was one of the very first programs that we had up and running here. What was it like, do you know, from when we were starting up Dental Hygiene?
Well, I know people took classes downtown, and I'm not sure, I think we're in the original clinic space that we had, which is a great space with lots of windows. It's been through a couple remodels since that time, new chairs, now we have computers at all the units, and we have all digital radiography. But I graduated from here in 1980, and the clinic is the same layout as it was then.
Let's talk a little bit about how the role of the dental hygienist has changed over the years. And I think it's probably true for many of our health professions programs where different pieces of the profession have changed in terms of responsibility. What's different now for our dental hygienists when they get out of here? What are they expected to know what to do in the area?
Well, I think we talk a lot about evidence-based decision making and looking at higher levels of evidence and making decisions based on evidence for our patients, not just anecdotal information. I think it's very important to be a lifelong learner. I think there's more of an emphasis on community. Like we rotate our students through Smile Healthy, the community dental center, and our graduates are much more involved in those types of settings than they used to be, which is great because access to oral health is quite an issue all over the United States.
But our dental hygienists, when they graduate now, are expected to be able to do a little bit more independent in terms of dealing with patients. I mean, I have a relationship.
Right.
You know, my dental hygienist is the one who sort of sets up the appointment. I sometimes see the dentist. I sometimes don't.
Yes,
which is fine with me.
That's right. Yeah. If you don't need the dentist, you only need that preventive care. That's really good.
Right.
Yeah. So yes, and there are a lot of, there are states that have more expanded duties for dental hygienists, advanced dental hygiene practitioner, dental therapists. That's not happening in Illinois yet, but hopefully in the future, because it will increase the access to care for patients that can't afford dental care.
Let's talk a little bit about the program itself. Like, how do students get into it? What are the prerequisites before you can get entered into the dental hygiene program? So
we usually recommend that students take their prereqs English 101 and 102, Psych, Soc, Com 103, and their A&P 1 and 2 and Micro before they start the program, because the program is tedious enough that if you have those courses out of the way, you're much better off. And most of our students do take those courses beforehand. So you have to have a 2.75 selective admission score, which is a combination of your total GPA and your science GPA divided by 2. So it relies heavily on the science. And then we probably, a good 2/3 of our students come from out of district, and we take anyone in district that meets that requirement.
And how long is the program itself once you have been admitted into the program?
It's 5 semesters. It's 1 year and then a mandatory summer semester and then the second year.
So once the student has graduated from the program, then they're eligible to go to work right away as a hygienist?
Well, they have to be licensed, and that usually takes the state a little while, so they usually start working in about July.
And we've had a very, very successful placement rate in terms of our graduates. I know I meet them all the time, but it's been a very successful program for the college.
Yes. Yeah, I just met a young gal from the Rockford area, and she stopped in my office and is trying to get in the program next year, and I said, well, I think you have a community college up around you, and she said, yeah, but everybody told me to come to Parkland.
So that's nice.
Yeah,
that's nice.
So she's here taking her prereqs and getting ready to apply.
Talk to me a little bit about the way in which the equipment, you mentioned new dental chairs in the recent not so long ago. Talk a little bit about the need for new technology as technology has improved and changed the dental field.
Yeah, well, we now take only digital radiographs, so we don't develop film anymore. The radiograph comes up on the screen. You can make it very large. You can use the cursor and show the patient where they've lost bone or where there might be some decay. And the radiation to the patient is probably less than half of what it would have been before. But yeah, it's important to stay up with that technology and to utilize it. And the electronic health records, now we do quite a bit of our charting on the computer. Mm-hmm. And so students have to learn how to import all that. And we have a computer and a keyboard right by every chair. But you also have to know how to keep things clean so things aren't contaminated with all of the different aerosols and everything. So
the instrumentation itself, has that changed much? Has that improved?
There's always new instruments and new, they used to have a really skinny little handle and your hand would get cramped. Now they are more ergonomic, they're fatter handles, they're lighter. They have different bends and twists on them, so it makes it easier to get around the teeth. Mm-hmm. So things are always evolving. It's always fun to, yeah.
The human element, though, is one of the things I know you focus on and stress in terms of like patient care, which is true for all health professions, but specifically for your dental hygienist, there's a lot of emphasis that goes into creating a good environment for the patient, right?
Yes, many people do come into dental appointments fearful. They've had a bad experience. And so we talk about our patients coming in with a backpack and you don't know what's in that backpack. And it might be personal issues, it might be anything, a bad experience. And so we are not just cleaning someone's teeth, we're treating the whole person. And that mouth is attached to the whole body. And so a lot of people don't understand why we would take their blood pressure or why we would ask them to be on pre-medication if they've had a joint replacement. Mm-hmm. Well, when you're cleaning someone's teeth, you can introduce bacteria into the bloodstream that spreads through the whole mouth or through the whole body.
So when we're talking about dental care, and I think this is an important point to stress, we're really talking about whole health care. I mean, whole body care. I mean, we're
absolutely.
Really, the teeth are such an important part of our bodies, and if you have unhealthy gums and teeth, it can generate all kinds of other problems throughout the body.
Yeah. Think about how it affects your appearance and your speech. There's a new book out that's just fascinating. It's called Teeth by Mary Otto. Oh. And she talks about the significance of oral health and how people live in pain and how they don't feel good about their smile. And so it affects, how you feel about yourself every single day. It's really something.
You've also done a lot of work in your career here at Parkland in working to engage the students in learning within the community and in serving. And you mentioned Smile Healthy, but I want to go back to something you did quite a long time ago, and that was a service learning program you did in India, and also in the last decade or so, work that you've done down in Tennessee. Can you describe a little bit what those projects were and how you came to get involved in them, and also what the impact was for the students?
I did my first mission trip the summer after I graduated, and I always showed my slides to our students, and so one year some of the students said, let's go somewhere. So I made a contact with a gentleman that had contacts in India, and he said, do you want to go to India? We said, okay. And so we took instruments and hygienists and went to India for a couple weeks, and it was a really hard trip. We did that twice. And then we hooked up with a organization called Remote Area Medical in Tennessee, where they do weekend trips, and we took busloads of students and went there for the weekend and helped them. We've been to Guatemala, and recently, when you do trips like that, not everyone can be involved, and they're extra time and they're extra expense. And so recently we have teamed up with the local dental society to come into our clinic, and we can do a whole day and we can treat 100 patients, and oral surgeons from Carl and dentists come in and they do extractions and fillings, and we see almost 100 patients. So I feel like we started off the hard way,
Sure.
and we've moved back home now. And not that we wouldn't be involved overseas, but more of our students can see the impact, and we can impact our own community.
One of the things I know when we talked a while ago about Tennessee was for the students and for yourself and your faculty, the incredible need.
Yeah.
I mean, people lining up all night the night before, the first time they'd seen a dentist in maybe 10 or 20 years.
Right.
I think that has had a profound impact on our students, right, as they've gone
Yeah,
through.
absolutely. Yeah. And we see that here.
Well, I was going to say, so the same thing is right here at home.
Oh, yeah. People would be surprised at how many people lack care and live with pain and need that care. It's really good for us to collaborate with the dental community as well, because we have some amazing dental professionals in our community. And to open up our clinic and to all work together is really important as well.
And it's a good sort of reminder of the work that we do as a community college in the engaging the community and learning to talk about it.
Absolutely.
And making our community a better place because of the work that we do here.
I really appreciate the support from the administration and that they let us do that. It's a great experience.
Well, I think it's a two-way street. I mean, I think it reflects well on the college, but I also think it is a really good thing for our students to do, and hopefully when they get into practice as working dental hygienists, that they can then sort of continue to do the good work of maintaining oral health.
Yes, I hope so.
Thanks so much for your time
Thank
here
you.
today, Peg. We'll be right back after this short break.
Hello, my name is Jenna.
And I'm Mary, and we are both students in the Parkland College Dental Hygiene program.
Today, we would like to talk about early childhood cavities. Early childhood cavities are 100% preventable. A cavity is a hole in the tooth surface. This appears as a white, yellow, or brown area most commonly found on the front teeth.
The main reason children get cavities are due to sugary drinks or juices that are placed in the baby's bottle or sippy cup. It is very important not to put your child to bed with milk, juices, or formula. Only water.
The sugars create an environment for bacteria to grow and stick to the teeth. These bacteria will grow and form plaque, which is a white sticky film that stays on the tooth if it is not removed daily with the toothbrush. Limiting your child's sugary snacks is also very important.
Adding fluoridated water, such as water out of the faucet, can help decrease the chance of a cavity in your child.
Research has shown that babies are not born with bacteria that cause a cavity. Rather, they are affected by their primary caregiver, typically their mother.
Bacteria can be shared from a mother to her child, and it is extremely important to remember to never put your baby's pacifier in your own mouth.
One way to keep your child's mouth healthy is to use a finger brush and gently rub along the gum line after each meal.
A gauze square or washcloth can also be used to clean the gums.
If your child has baby teeth, it is very important to use a small child-sized toothbrush. Be sure to remember to clean your baby's mouth in the morning and at night. Also help your child brush their teeth until they are at least in the first grade.
Your child should have the first dental checkup by the age of 1.
Day 1 got off to a slow start,
The morning was a little bit slow. We didn't have a lot to do.
but it wasn't long before the students were put to work.
Seems like a lot more people are coming in and there's a lot more jobs to be done.
We're just rotating around trying to do everything. We have OHI, we have the sterilization, we have the extractions, hygiene, 3 chairs.
As the morning developed, most of the students found themselves rotating from station to station, either assisting dentists, cleaning teeth,
I'll have you open for me.
sterilizing instruments, or performing OHI.
What you don't want to do is brush really, really hard.
OHI stands for Oral Hygiene Instruction. Prevention is just as important as maintenance, and Parkland's dental hygiene students wanted to utilize the RAM clinic to stress that.
Talked to some people out in the front. We talked about teeth brushing and the importance of keeping your teeth clean, how to floss and how to brush. Handed out toothbrushes and toothpaste. And now we're sterilizing instruments as fast as we can. They're really busy.
Sterilization is definitely a dirty job, but the Parkland volunteers have it down to a science.
So we have this whole little assembly line thing going here. And it goes from here to over there so they can get put in the ultrasonic.
And with the amount of people waiting to be treated, every job being done is an important part of the process. Midway through day one, the greatest need is for teeth extractions and fillings.
The 4 dentists that we brought, I think, are mainly doing extractions. They're staying busy, and we'll just see how the day goes.
We've extracted quite a few teeth from, 8 this morning. Basically been doing extractions all day.
The second-year students have spent a good amount of time cleaning teeth in Parkland's clinic. But with all the dentists hard at work, a new opportunity is available.
I think we also have some students actually assisting dentists, which they may or may not have done that before.
I started off assisting a dentist with extractions, and that was very interesting because I've never assisted before, and I don't have any assisting training, but I got a little bit today.
Certainly a lot of hands-on learning with the assisting. It was great because I quickly anticipated what he needed, and that part was fun. I think I would enjoy doing some assisting. I'd like to do the dental hygiene and assist when I might not have a patient, so I like that part a lot.
What's great for the students is also great for the dentists.
They've helped me out quite a bit, everything from sterilization to assisting. I think some of the hygiene students are doing some prophies. They're getting a lot of experience, so it's just a wonderful thing.
As the dentists continue to work through the long line of people who are in need of extractions and fillings, the group from Parkland decides to take things into their own hands.
We have a lot of dentists here today, so they are taking most of the dental chairs that were made available. So we really only have about 2 to 3 chairs that we can use for dental hygiene, but we have a long line for people that need cleaning. So what we're trying to do is do a makeshift, set up makeshift operatories over here so that we don't actually have to take space that is needed for restorations and for extractions. So we have students working, we have registered dental hygienists that came with us working. We just felt the need was so great that we decided to try and do it this way. Obviously this is not perfect, but we're doing the best job we can with the facilities that we have, and we want to see as many people as we can.
While the conditions are not ideal, the future hygienists are adapting well and at the same time realizing they have things pretty good back in Champaign.
We definitely are realizing how spoiled we are at Parkland. We have everything we could possibly need or want, and now it's a little more primitive here, and it's a little more challenging, but it's been good.
Welcome back. Joining me in this segment, 2 dental hygiene students from Parkland College, Lexi Hughes and Taya Torkelson. Welcome to the Parkland Report.
Thank you.
Alrighty. Lexi, start with you. Whereabouts are you from, and how did you end up coming to Parkland to study dental hygiene?
I'm from Petersburg, Illinois, which is around Springfield. I actually just researched dental hygiene schools on the internet and found Parkland, and this was the first dental hygiene school I had visited, and I absolutely loved it. And I knew the day I visited here that this is where I wanted to go.
Excellent, very good. Taya, what about you?
I'm from Morris, Illinois. It's closer up north by Chicago. I went to Parkland actually a year after high school, so I did my gen eds before, and then I went here. I could have went to College of DuPage, but it was just a lot more convenient. Everybody was a lot nicer when it came to the application process, so I ended up choosing Parkland.
So Taya, why did you decide to become a dental hygienist? Were you always fascinated with teeth?
I've never had a cavity, so I've always had good experiences at the dentist's office. So when my patients ask me about that, I'm like, I guess I did love the dentist, but I never thought I was going to be like a dental hygienist. But I love to clean, so that really works out because I'm cleaning teeth every single day. So
very good. Lexi, what about you?
I've always loved teeth. So, I mean, like, even when I was younger, I loved going to the dentist. So I told my parents when I was younger this is what I was going to do, and here I am, so.
All right, you're talking to somebody who never wanted to go to the dentist ever in his whole life, so I'm thrilled to meet 2 people who like dentists.
Yeah.
Tell me a little bit then about the course of study here at Parkland. You're in your 2nd year, so what has it been like?
It's been stressful. I know Peg talked about usually taking the gen eds first, but I came in straight out of high school. I moved here like 2 weeks after I graduated high school, so everything that I've done so far has been pretty difficult. It's always workload, have a lot.
And in terms then of the dental hygiene classes themselves, I mean, have you found the science interesting, or?
I find really like the anatomy that we study of the mouth is actually really interesting. So I love those classes where we get to talk about like the anatomy and like the diseases that can actually occur in the mouth.
So today it starts off basically, right, you have to operate or learn how the whole mouth operates and how teeth function and the whole anatomy and physiology of the body, and then the things that can go wrong. What do you like best about it? Do you like learning about how it works when it's working well, or do you like learning about how things go wrong?
I like more of the when it goes wrong. It's hard to learn it all, but once you learn it, I think it's a lot more interesting. Honestly, I was terrified to give injections over the summer, and then now that's my favorite part about clinic. Things like that, you overcome obstacles that you never thought you were going to be able to do. So
for dental hygiene, there's a lot of like, you know, sort of academic sort of study of the process and everything that's involved. There's a lot of science, and there's a lot of like, you know, there's anesthesia, there's numbing, there's all kinds of instrumentation that you have to use. Can you talk to me a little bit about what it's like to sort of like do the theory, but then also the application of it? Because you're working with patients rather pretty quickly once you start?
Our second semester, so starting spring of last year in January, we started with patients, and when it comes to like the theory and then the application, we have like different evaluations that we have to accomplish throughout clinic, and it's like what we learn throughout each semester, we kind of just bring it in to clinic. And this is our third clinic, like we're in clinic 3 now, and I know so much more like about what I can tell my patients to do with certain like sensitivity in their teeth, to anything. Like we also are having, like we're taking nutrition class this semester, and we have a nutritional like evaluation in clinic, so we're just bringing it over to clinic all the time.
So do you find, Lexi, that when you get into the actual clinical portion of it, that it makes it come alive, like the theory that you've learned, it's, oh yeah, now I get why we do it. Does it make more sense?
Yeah, I think a lot of things make more sense. You can only learn so much on paper when it comes to this profession, so I think once you actually get into clinic and you're working with patients, it becomes so much easier, it comes natural. I know when we first started it was difficult, but now like a lot of the things we do just really come natural to me. So
and for the most part you're working with actual patients, right? These are not simulations or pretend.
We see 3 patients from the community a week, and so we're working with actual patients that have gum disease and a lot of problems, so that really helps us learn.
When you are working with patients, I'm imagining in a clinical session you're working with smaller groups of students, like you're not on your own. How does it work working with a group of people solving a problem? Is that something that's useful?
It can be. Like when we're in clinic, we sometimes have partners, so that can be really helpful depending on like what we're trying to accomplish. But it's also like individual.
So I was going to say, Taya, when it comes down to it, it's you and the patient, right? You can't really have 2 people working on one person's mouth at a time, right?
It's not, I mean, we definitely, like in the very beginning of our first clinic, we were with partners to kind of help us ease into it. But now that we have our own patients, like I prefer to be by myself. But technically we'll learn different things from different people. So, and like I love having an instructor right now while I'm learning, because each instructor tells us something different, which is always helpful. Every instructor has something different to tell you. So it's not exactly just, I guess it's not exactly just you and your patient, it's also the instructor while you're in school, because they really help us throughout the whole process of everything.
Getting you through the program?
Yeah.
So Lexi, I know from the past that dental hygienists and dental hygiene students are a very tight group, that you tend to work closely together. You have a sort of a collaborative team approach to getting through the whole process. Can you talk a little bit about what it's like to be a student with other students in the program?
I mean, you start out the program with 35 other students and you go 2 years with them every single day. So, I mean, having everybody there, like, you really do become like a family. I know, like, a lot of us are friends and we do stuff outside of school together. So it's really nice to have, like, that close-knit group of people.
Can you talk to me a little bit, because I know that in addition to all the academic work you're doing and in addition to the clinical work, you're also asked to be part of some of the community outreach pieces. I'm not sure, I mean, obviously you're working in the clinic, so you're seeing some of that, but I'm not sure if you've done any of the volunteer activities for the community yet.
Well, we go to Smile Healthy twice a semester, so that's always nice because that gives us like a good look on what like kind of community like based really is.
So where is Smile Healthy located?
It's here in Champaign. It's I'm not exactly sure where it's at.
It's isn't it on right off of Prospect,
yeah, it's right off
by
of
the
Prospect.
Dunkin' Donuts?
Yeah.
Good place to have a dental kind of place, right by the donut shop.
Yeah.
So what goes on there? What goes on at Smile Healthy?
So when we go there, we see 3 patients and we get an hour and a half with each patient. And we usually get someone who has periodontal disease, which is a gum disease that we treat, and then a kid, and then somebody else. And so we just get to treat those patients in a more like practice setting instead of like a clinical setting like here. Mm-hmm. It's more like we're out in private practice instead of being in clinic where our instructor's like right over our shoulder.
Sure. Mm-hmm. What about for you, Taya? What was your experience of working with the Smile Healthy program?
Smile Healthy, I loved both of my experiences with Smile Healthy so far. Makes you really see what is really out there in the community, which we see some of it here at Parkland too, but it's more like, since we're just dental hygiene, we can't do extractions. So like I assisted with the dentist, got to assist his extractions of teeth and stuff like that. So it's going to give you more of like the assisting and hygiene part of it. And it's nice to actually have the normal, like when we get out of Parkland, we're going to be expected to clean people's teeth in an hour. And so it's nice to like have that schedule of, we need to get used to that because right now we have 3.5 hours of clinic. So it's been really, really eye-opening to see the different patients that come in and how much help they need and how much they need like us to be working in these public facilities.
Has it made both of you much more strongly advocates for healthy teeth and healthy oral hygiene?
Mm-hmm.
Yes.
Definitely.
So is that something that you think you will continue to do once you've gone into working, Lexi? Are you going to be trying to help give back to the community as part of that?
I mean, I really hope so. I'm not really sure what exactly is like community-based back where I'm from, but I really want to try to stay connected with the community because it really is like an eye-opener how many people really do need the help that we provide.
Well, we're really glad that you're on the road to being successful dental hygienists, and thank you so much for taking the time to be with us here today on Parkland Report.
Thank you.
Thank you.
That's it for this edition of Parkland Report. We'll see you back here next time.